Chapter 11, Treatment of Sleep Disorders. When we're looking at sleep disorders, of course, there are various types, which is very important when we're looking at the type of medications as well as treatments for these disorders. One thing about insomnia that is an important note is that sometimes clients with co-occurring mental illnesses may also have sleep disturbances. So, for example, sometimes initial insomnia is an indicative um, to an anxiety disorder. So the client might actually have generalized anxiety disorder or an adjustment disorder with an anxious mood. Also with insomnia, with middle insomnia or which is the intermittent awakening, this can also be an indicator that they may have an affective disorder or an affective component such as major depression, dysthymia, or an adjustment disorder that has like depressed features or mixed features. So that's just something to keep in mind if a client comes saying insomnia might not be just the sleep disorder. It could be another disorder that is causing these symptoms. So it's very important to rule that out. But moving forward, as sleep bruxism, which is another word for the teeth, another term for teeth grinding. Parasomnia is sleepwalking, night terrors, which of course can affect our sleep. Obstructive sleep apnea, OSA, narcolepsy, and restless leg syndrome. So looking at some medications, we are looking at now the sedative hypnotics. We kind of talked about the sedative hypnotics and anxiety disorders, and we talked about benzodiazepines as well as phenobarbital, which was used at one point, or the barbiturates. But for sleep, there are non-diazepine drugs as well as benzodiazepines that can be used. The non-benzodiazepines for treatment of insomnia are the ones such as Ambien and Lunesta. These are sedatives and hypnotics that, of course, with the release, allows the client to relax and fall asleep with relative ease. And stay asleep. Let's add that part to it also. And the key components with like a Lunesta or an Ambien, which is the non-benzodiazepines, is the chemical components. It has an immediate release tablet that helps the client fall asleep pretty quickly, but then there's an extended release form which allows the client to pretty much stay asleep. So those are the components. So if a client has a problem falling asleep, of course it addresses that relatively quickly, but then if they also have that intermittent awakening, that medication has an actual second layer, a first and second layer that will dissolve. That's an extended release that will, like I said, allow them to maintain sleep. When we look at benzodiazepines, it's used to treat parasomnias. We know that benzodiazepines has that sedative hypnotic effect. It's a mild tranquilizer. So when treating parasomnias, if we're looking at the sleepwalking, the sleep talking, with this, if it has that sedative effect, it will reduce those behaviors because of the sedation part of it. Occasionally, benzodiazepines are used in short term for insomnia and bruxism. Now, something that we need to keep in mind is that if we know that our client has a history of substance abuse, this might not be actually a good fit, the non-benzodiazepines as well as the benzodiazepines, because they do have an addictive quality. So we must keep that in mind when we are, thinking about medications for our clients or when we're discussing these type of medications. Other drugs to take into consideration, we have melatonin receptor stimulators, and this is used to treat insomnia. And what this is that the theory is that perhaps a person is experiencing insomnia due to a depletion in melatonin. So the key is if we provide a drug that's a melatonin receptor stimulator, such as Rosarim, this could, of course, bring up the levels of serotonin within us or within the person who's having insomnia, and perhaps improve their sleep quality. Opiates are also used, but it's used for restless leg syndrome. And if you look at the qualities of opiates, you will find that, overall, they have, they bring forth a feeling, a euphoric feeling, a pleasurable feeling, a relaxation, a contentment. Um, it kind of slows our system down, reduces feelings of pain. So for people who are experiencing restless leg syndrome, this might be an option because of the components and the effects of what opiates such as oxycodone or methadone has on the body to relax it, to if those restless legs are feeling, the pains, the pins in them, the opiates are those receptors that will go in, like I said, decrease those feelings. So that is also an option. Anticonvulsants such as Tegretol or Depakote can be used for restless leg syndrome, as well as insomnia related to bipolar disorder. And we know, based on the previous chapters, that anticonvulsants are sometimes used for clients who have bipolar disorder. So if it's bipolar disorder along with insomnia, it's great because it's knocking out, of course, besides the disorder, but then other symptoms because of the disorder at once, or even if it's co-occurring, it is taking care of both. Although anticonvulsants is also used, of course, as a medication for preventing seizures, the thought is with the restless leg syndrome and the constant movement that perhaps, and it has worked in some cases, that it will reduce those symptoms of the restless leg syndrome. So sometimes anticonvulsants can be used. Finally, with the antidepressants, individuals who have insomnia, who are depressed and as well as non-depressed, have found that sedating antidepressants such as a trazodone have been effective in their sleep quality. These type of sedating antidepressants like a trazodone should be used primarily before bedtime to avoid daytime sleepiness. It also has, like I said, been found to improve the quality of sleep for both depressed and non-depressed clients. So this is something to take into consideration, especially if, once again, going back to a client might, have depression, and as well as have the insomnia. It's kind of knocking out two birds with one stone. Something just to keep in mind in determining the best type of medication use is, of course, half-life and the onset of action, because we have to keep in mind that, of course, many of our clients have work, family, and different things to do. So if they are waking up groggy and they can't get out of bed, although they, are the sleep quality is better, or relatively better, the insomnia is not there, but just the aftermath of it, it might not be worth it, which will play a part in medication compliance. Anti-narcoleptics such as Provigil, as well as, or Nuvigil, Oxyrim, I'm sorry, not Oxyrim, Xyrem, there we go. It's been a long night, so bear with me. But Xyrem can be used to improve daytime wakefulness, and that is the key. And the chemical compound of these medications can cause a person to be more alert and remain awake. And that's the key, of course, with treating narcolepsy. It's also been used for sleep apnea. It controls daytime sleepiness and loss of muscle control in people with narcolepsy. Orexin receptor antagonists, or Belsomra, this is used to regulate the sleep-wake cycle. So when we look at our, our 24-hour cycle, our subjective night, our circadian rhythm, this regulates and it plays a role in keeping people awake with narcolepsy. So just depending on the client's symptoms, what they're experiencing, of course, the physician would choose the appropriate medication for the individuals. We look at obstructive sleep apnea, OSA, what's used to treat that, and kind of mentioned in the previous slide that perhaps an anti-narcoleptic can be used, but the most common thing that's used is a continuous positive airway. And a client who uses this will use it every night while they're asleep, and the CPAP machine will have either a mask that covers the nose and the mouth, or a mask that just covers the nose only. It depends. Of course, the client would have to be assessed to figure out what the appropriate mask to use. And then there's also prongs that fit into the nose. But the overall concept of this is just to keep the airways open, because we know with the obstructive sleep apnea, at one point the airway will collapse, which leads to those 30 seconds to a minute where they are not breathing. So this continuous positive airway pressure keeps the airways open. There are other medications that need not be prescribed that individuals can use who are having some sleep problems, because sometimes it just could be stress and short term. So we look at things like Benadryl that can be used. I mean, there's over-the-counter sleep aids also, like a Nytol or even a generic version of that can be used to assist with sleep disorders. So I mean, that's something to take in consideration. Just something else to mention, that barbiturates used to be used. However, as mentioned in the previous a couple of chapters ago, that because of the spectrum of it could just be sedating to almost use as an anesthesia, and as well as the problem of the high potential for abuse, it is very seldom used in these days and times as a treatment for sleep disorders. Here are a few FYIs from behavioral techniques for treating sleep disorders that clients may want to consider. You might want to bring to their attention is sleep hygiene tips. So of course, reducing such substances as alcohol and caffeine, or stimulating substances that can of course cause them to be awake. Have a regular wake-sleep cycle, avoid napping, and there's quite a few other sleep hygiene or behavioral techniques that can be used to also improve sleep.